So here we are, we're back and we're doing the second step of the assessment. This is the hip abduction assessment. So we're looking to assess one, the adductors, and two, the abductors. So our glute med and also our abductor magnus. So these two muscles obviously can battle it out for function and superiority. The adductor magnus, if it is overloaded and overactive to a certain degree, we can sometimes find that that will inhibit the glute med. So that's a really important part, especially when we're assessing our athletes as they're running through that stride. And I've mentioned to you before, especially with the video analysis. Hip abduction, once again, this is quite simple. All we're doing is, I'm going to be assessing Cal's right leg here, so I'll stabilise his left by putting my hand onto here so that there's no movement here. I simply take a light grasp around his ankle, and we're just going to walk out the other leg. So what we're looking for here is any of the passive restriction again. Now there's three different sites we can feel this. One will be potentially the short adductors, that'll be up very high towards the groin. The long adductors coming down more medial here towards the knee, or potentially we may even feel it out in that glute med or the lateral hip area. Now it is imperative that you absolutely 100% look and feel whereabouts that restriction is. So important, because if you're feeling in the short part of the groin up high, then you may be looking at the adductor longus. If it's coming down more towards the hamstring, then we're probably looking more at the adductor magnus. So simply just taking it out to that end range, feeling that passive restriction. Obviously you're going to ask your client, your athlete, whereabouts they feel that, and that should give you a good indication of whereabouts or which one of these adductors is probably more at play. So simple process.